Hi, this is Dr. Darwin Hayes, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Coach Show. Be sure, if you haven't done so already, that you subscribe so that you are able to get all of my videos that are posted on a weekly basis. I post videos on Mondays and Thursdays, but I also have other videos throughout the week, so you don't want to miss them. So the only way you don't miss them is if you subscribe so that you'll be notified. Today, we're going to be diving into our new series called Careers in Dentistry. Careers in Dentistry. And today, we have a longtime friend and colleague. Even though he has the letters in the year of 1911, he's still a good friend of mine. He just went to another side of the fraternities over the years, but it's okay. We still love him. We have Dr. Antwan Treadway here, oral surgeon, and today we're going to learn how to become an oral surgeon, and not just any oral surgeon. This is an oral surgeon who's also an entrepreneur at the same time. So, Dr. Treadway, welcome.
Good morning. Good morning. How you doing?
Man, I'm doing great, man. I'm doing much better now that I'm in your presence and ready to learn more about you and your chosen part of your chosen part of dentistry, your specialty. So tell us a little bit about yourself.
Well, I'm originally from a small town in Florida called St. Petersburg, Florida, right outside of Tampa. Ended up going to the University of Florida for undergrad, and from there, did my first year of dental school at Howard, but financial constraints led me to go back to the University of Florida, finish up, and after that was when things really took off. I did a GPR in New York that you're quite familiar with, Bronx Hospital, Dr. Paul Gates, my mentor. And from there was a springboard to go to oral surgery out in Los Angeles at Martin Luther King Hospital. And from there, ended up going to join the faculty at the Medical College of Georgia. And after being in the faculty there, left and went into private practice. And I've been doing private practice ever since about 2002, 2001, 2002.
Gotcha. So oral surgery. So what about oral surgery when you were first looking at it, whether in dental school, maybe even before dental school, but at some point you knew oral surgery was your path. At what point was that for you?
I think for me, it really came, or the point really got made for me, came home when I was doing my general practice residency. During my GPR, I got really exposed to what the practical areas of general practice were like. You know, dental school is a bit different. Dental school, you're busy learning the basics, you're busy learning techniques, and you're really learning how to be a dentist. But when you start to apply how to be a dentist, I think that there were some aspects of general dentistry that I really liked, and there were some that I just didn't really care for as much. And oral surgery just kind of took my interest, kind of took the foreground of my interest. And I was fortunate enough to be at a place where I was able to cultivate that, which was Bronx, Lebanon. And it kind of grew from there, flourished from there. And that's what kind of led me to it, because I think that I just enjoyed that aspect of dentistry. You know, I think that we get kind of sometimes pigeonholed into what dentistry is. Dentistry is either a caricature that we see like in movies, or it's, you know, just dealing with, you know, just the teeth and exactly how we, you know, restore a cavity or something. That's not what dentistry is at all. You know, dentistry is oral health care. And that encompasses so much, from everything from your nutrition and the way that you take care of your oral health, to the way you fix problems, to trauma, to, you know, just a myriad of things. And it is a really expansive specialty of medicine that people sometimes get a little bit twisted. But hey, I've enjoyed being able to correct some of those misconceptions, and I've enjoyed learning to do this specialty and to become a surgeon. So.
Right, right, and that's key to kind of share what you just said, which was dentistry is a specialty of medicine. I mean, we are like specialists of the oral cavity, but also all these structures that are part of that are on the head, that are on the body, that are part of the body too. So I'm glad that you pointed that out. Um, your training, what's your training like? What's a training like for an oral surgeon? I know there's a couple of different paths. You mentioned actually doing a GPR beforehand, and that may not be the traditional way that most people go into oral surgery. But typically, what's the training like to become an oral surgeon, and what are some of the paths associated with that?
That's a great question. Typically, there's basically two typical paths, and those typical paths are you graduate from dental school and you go into a traditional 4-year oral surgery residency. And during those traditional 4 years is when you learn the specialty, you learn surgery, you learn aspects of medical management of patients and medical management of pathology and the actual surgery itself. The other track is an additional 2 years, which is a 6-year track, where you may come with a combined degree, medical degree, as well as you get you finish off your MD degree, as well as get your certificate of certification in oral maxillofacial surgery at the same time. Like I said, that track is 6 years. The other track traditionally is 4. But what's, I think, been kind of almost a hybrid to some of that is quite a few people now, and I did a GPR before I went into oral surgery. So some people will do internships where they are an intern for a year, some 2, some even 3, before they actually get to residency. And during that time, you're training alongside oral surgery residents, but you are not a resident yet. And in some estimations, I think that those people are highly valued because when they get to residency, they hit the ground running. And, you know, unfortunately, as a student, most of the time we're a little bit impatient. So if you have to go that route, people feel like, well, I kind of spent a year or 2 not doing what I wanted to do. But that's not a bad thing at all, because I honestly believe that by the time you hit the ground running from an internship, you were really ready to flourish as a resident. And that's a very important period. That training period is how you learn to become a good doctor. You know, you can teach anybody how to do a procedure, but to be a doctor means you have to diagnose, you have to know when to use the procedure and how to do it properly. And I think that those are critical elements that you learn during those kind of, you know, periods of time.
Absolutely, and you know, we've got at Bronx Lebanon at the GPR program, we have many residents that are going that path of oral surgery, and one of the ways that they kind of solidify that and confirm it is by doing an internship. They'll do an internship year right after a GPR 1 year, and it's a win-win. It like you said, it allows them to kind of hit the road immediately to really find out if this is the career that they want, but it also exposes them to a program that will begin to train them and hopes of maybe when they apply to that program in oral surgery that they kind of have a little bit more, that person who's applying is less obscure to them, and they're more known, and which will hopefully increase their chances of getting accepted to that oral surgery program. So you're right. That's a new pathway into oral surgery that we've seen also in the last several years. So that's good. So now, I said that's another pathway. Go ahead.
I'm sorry. I was just going to add that, you know, I really do think that it's important that people understand that if you do go that path, that is not anything to feel like I haven't done this right or I'm not qualified enough. When you get to do those internships are basically year-long interviews. And what it does is it really assures the program that you're going to that this person is committed. This person has a good knowledge base or has started a knowledge base that we need. And it makes a big difference. And I really think that from time to time we get frustrated because things don't go the route we thought they should have gone, but they kind of go the route that they went. And I think that those are really important times. And I think that the importance of something like what you're doing here, Darwin, and what these kind of information sessions can do is help you understand and better realize where you are along the path. It's success is not to go full bumper sticker philosophy, but success is not a destination, it's a journey. And so you got to take that journey, and where you are along that journey is just where you are. So,
yeah, absolutely.
I don't want to philosophize too much, but
but that's okay. I mean, we here on the New Dentist Coach podcast show, we like to hear philosophy too, because those are some of the things that allow people to get the full understanding of the process and how it works and how things come full circle. So that's all good too. Hey, but I just got an idea. That whole notion of the internship, I think that might be another topic for us to dive into on another show, because again, it's very competitive for your specialty. Some people go many different routes. In addition to internships, there's people that go into an anesthesia residency to get into oral surgery. And I've heard that from many practitioners as well. So that might be another show for us to kind of dive in the importance of internship. Definitely. So what's your typical day like as an oral surgeon, especially in your practice, and how you have your business set up?
Typically, what the day typically goes like is we'll start at 7:30, 8 o'clock, sometimes 8:30, somewhere in between 7:30 and 8:30. And we will do cases in the morning. I mean, we're doing actual surgeries in the morning. And this is a private practice schedule. Do surgeries in the morning. Sometimes filtered or littered with consults or follow-ups. And then take a short lunch break, either spend some time with a referring doctor to go over some cases, or perhaps to introduce ourselves and get to know each other better, to kind of quote unquote market the practice, and then go back in the afternoon and do consultations and follow-ups. And those consultations and follow-ups are set up for the next days or the next week's surgeries and so forth like that. So your typical day runs from 8 o'clock till 1 during surgery, 1 to 1:30, 1 to 2, a short lunch period, and then from 2 to 5 or 2 to whenever, actually, your consultations and follow-ups, and some days late surgeries, sometimes hospital cases, things like that.
Right. So it seems like all of your major procedures and things that you get done are done in the first part of the day, probably when you still got a lot of energy, got that adrenaline going, the coffee going, and everything else. And then typically the end of the day is more, like you said,
Right.
consults and maybe some surgeries, but planning.
Another important component of that is, as you know, for a lot of the procedures that we do, we're also providing sedation and anesthesia. So our patients need to be in PO or not have had anything to eat or drink. So to be a conscientious provider and to also make sure that your patients adhere and are compliant, you want to try and do those cases in the morning as opposed to doing them, 2 or 3 o'clock in the afternoon if you can avoid it, because it's more difficult for patients to stay in PO for, 6 or 8 hours, as it were, throughout the day than it is for them to just kind of get up in the morning, come to get their surgery done, and then go home. or go, the other route. So, of course, people can stay in PO for 6 hours at any point in the day, but it's usually a little bit easier to confirm and have a little bit more confidence that they are compliant with you first thing in the morning. So that's another one of the reasons for that schedule.
Gotcha. So can you describe some of the typical procedures that you do as an oral surgeon?
Yeah, I mean, in private practice, teeth and titanium rule the day. So that is what, no matter, I don't care if you train at Harvard or you train at Walmart, you're going to, as an oral and maxillofacial surgeon, you're going to do dental alveolar. You're going to become very proficient at dental alveolar surgery. Dental alveolar surgery, implants, the other aspects of oral surgery, which are trauma, which are, pathology, larger surgeries and things, you're going to do that. But your average day is going to consist primarily of dental alveolar surgeries, implant surgeries, pre-prosthetic surgeries, getting patients, helping patients with pathology, helping them with chronic pain situations, i.e. TMJ or musculoskeletal problems, from their dentition. Those are the primary things that you're going to do during the day. But any aspect of oral surgery that you're interested in, that's how you end up tailoring your day. I know plenty of private practice surgeons who do a lot of orthodontic surgery, but they are kind of set up to do that. And there are plenty of us who try to do what we call full scope, meaning that we'll have, an orthodontic surgery patient. And right after that, we'll have some wisdom teeth, followed by a couple of implants, and then looking at a cosmetic procedure. So you're gonna run the gamut, and it really is the type of a specialty where you can tailor it to what your interests are. And I think that that's very important too. You don't get pigeonholed. You don't have to just take out teeth. If that's what you like to do, then great. If you don't, then you can tailor it to do other things. But you got to kind of understand in that private practice business model, that's what most private practitioners docs are referring to you. They're referring to you to help this patient pass the surgery so we can get them to the next phase of restoration, which gets them back to the important aspect of the relationship with their general practitioner, which restoration, which is what dentistry is really all about. Let's restore oral form, let's restore oral function, and let's make it look good doing it. So, that's where we get hand in hand with our restorative colleagues.
Right. Now, those are some of the typical procedures. What are some of the atypical ones that, if you're not an oral surgeon, you wouldn't know that this is done in oral surgery or by oral maxillofacial surgery? What are some of the atypical ones?
Wow, great question. Like I said, there are cosmetic procedures that some of my colleagues really like to do. Orthodontic surgery is another one, but that, of course, is usually done in a hospital setting. Pathology, I think some of the pathology people may not understand that we do. Also, trauma. The trauma that we treat, orbital fractures, nasal fractures, zygomatic arch fractures, mandibular fractures. People will tend to think, well, if you break your jaw, you go to a surgeon. Well, also, if you get punched in the eye and you get a orbital floor fracture, you may end up at the oral surgeon. Typically, what happens in a lot of situations in a lot of hospitals, oral surgery is a part of a facial trauma team. So you may have plastics, ENT or otolaryngology, and oral surgery working together to cover the facial trauma for a given period, like say a month. So each of you may have a week that you cover facial trauma. And so during that time, that's what you're covering. And so I think that those aspects are things that people don't typically think of oral surgery as, because they do tend to think of wisdom teeth and implants. But we're out there doing quite a few procedures that all fall within our purview, and they're all as specialists of the head and neck, and that's what we are.
Right. And for those types of surgeries, are you collaborating with ENT or other specialists in the medicine field?
Yes, we are. Yeah, we do. We're definitely collaborating with everyone. So we will, whatever aspect of it that we need to do. If we have to, we'll collaborate with our internal medicine colleagues if a patient is in the hospital and they have comorbidities that we need to get under control before we're taking. We also do that as outpatients. We send out for medical clearances and such and get them ready. So yeah.
Right. Okay. So let's talk about compensation for all this hard work, all this training, these long hours. What would you say is a typical salary or a range for an oral surgeon? And let's say more in private practice, and then maybe if you have information on an academic setting too. But what's the typical range?
I think, it really runs the gamut. There are those out there, they're generally all of the salaries are in the six-figure range. And that's, somewhere in the low six figures, around $100,000 up, anywhere up to and above, 800, 900, even $1 million for some people. There is a wide range of salaries there. And I know that that's a kind of a very ambiguous answer to your question. I wish I could say that, everybody, 250 is the average. It really isn't. It really is, based upon how aggressive you are as a surgeon, how expensive your private practice is, and how you're able to, how well you're able to, market yourself, work with your surrounding referring doctors. But I would say probably average starting salary is anywhere from $150,000 to $250,000 as a just getting out of residency, and then it's gonna grow rather exponentially pretty quickly. The average oral maxillofacial surgeon is probably doing anywhere from $300,000 to $500,000 a year. Somewhere in there that's about average. And you, of course, in an average, you have some that are below that, and you have quite a few who would be shocked if they were that low after a number of years.
Right. Okay. I think that paints a good picture. Knowing what you know now, in these many years of practicing, your training, what would you do differently, if there's anything? Knowing what you know now, what would you do differently in the same pursuit of oral surgery?
I would probably have done a little bit more as a student. When I was a dental student, I used to go to grand rounds with the oral surgery team. And I did that for a period of years. But, as a student, you're so concerned with your requirements and you're learning every aspect of dentistry. So it took me a while to figure out whether I was really more interested in endo or in orthodontics or oral surgery. But oral surgery just kind of really was something that I always had as something I thought I'd be interested in. And so I think that I wouldn't change a whole lot. But one of the things I would probably do is just would have been a little bit more committed to spending more time with oral surgery, just so I would have experience at what they were doing. And like I said, it was during those grand rounds where there was no pressure upon me to sit there and answer questions, but I got to listen to them talk about aspects of management of infections and trauma and, all these different surgical procedures that they were doing or getting ready to do. And it was like, wow, I didn't realize they did that. Or like, wow, I didn't realize you had to do all of that. And so I kind of got a real appreciation for what that fund of knowledge or base should be. And so that would probably be the only thing I do different. Spend a little bit more time as a dental student with the oral surgeons and learn a little bit more from them, because that also only leads to better recommendation letters, which are important aspects of getting in.
Right. Absolutely. Absolutely. Okay. Sounds good. So advice. What advice do you have for pre-dental students, current dental students, or residents that are contemplating or aspire to be an oral surgeon? What advice do you have for them?
Um, Probably very straightforward. Get involved to jump feet first. I think sometimes the most important thing you can learn is what you don't want to do. As a high school student, I used to think I really wanted to go into pathology, and I went and shadowed a pathologist one day, and that let me know that was not what I wanted to do. If you think you want to do oral surgery, spend some time with some oral surgeons. I mean, and not just a friendly person in your community. Spend some time with those in academia, ones that you're around in school. Spend some time with ones back home too, because what you see in educational settings is not what you're going to see in a private practice setting. And if you think you might want to do academia, great. If you think you might want to do private practice, great. Just spend a little time getting to know each of those aspects better. And I would say that, make sure that you are ready when it comes time to apply. Get yourself well organized. Understand that when you ask people for letters of recommendation, ask them if they can write you a favorable letter of recommendation. As a member of the admissions team, when I was on faculty at the Medical College of Georgia, I saw a lot of people who were torpedoed by their recommendation letters. And I don't think, most of them, you would go to, Dr. McGillicuddy and say, hey, Dr. McGillicuddy, can you write me a letter of recommendation? And Dr. McGillicuddy would say, yeah, sure. Well, he didn't recommend you for the program. He really recommended that you concentrate on some other areas. So,
that's not
if they can write you a favorable letter. Now, it doesn't mean they will, but that puts the onus on them of being honest with you. And if they don't think that they can write you a real favorable letter, they should tell you that, well, I really don't know you that well, Johnny, so maybe you might want to ask another one of your professors, or, oh, of course, I'll be able to write you that letter, and let them write you a letter, because those are important. Those are important aspects of it. But probably the most important aspect of it is being organized and to follow up and to understand that nobody determines your path but you, whether you make it in the first time or the fifth time. 10 years after you finish your residency, nobody's going to ask you, did it take you 3 times to get into oral surgery, 1 time to get into oral surgery, or were you in 3 internships before you started your residency, and now you've been practicing for 10 years. The patients are going to want to know 2 things. Are you going to hurt me, and how much is it going to cost? And you can be able to answer both of those with confidence. First one, no, we're not. We're going to help you. And the second one is, this is what it is, and we're going to work with you, and blah, blah, blah. But, don't accept your position now as your final endpoint. Like I said, it's a journey, and you just somewhere along that path. And we really all are, man. Even once you finish, I know, what you guys are doing over there at Bronx Lab, and all the great things that Dr. Gates and those people have done for me, and the things that I try to do for some others, because of what was done for me, and the debt that I feel that I owe for that. I think that those are important aspects of things. You got to kind of keep that in perspective.
Yeah. Oh man, that's beat. So be organized, be ready to apply, be intentional when you get those recommendations. And most importantly, you said spend time in oral surgery a little bit much earlier, spend time in different types of settings, private practice, academia, and to see what you like, what you don't like, but just so that you're more familiar with all aspects of the profession. And I actually think that might be another good show to talk about as far as some successful tips in applying to oral surgery, especially from someone like yourself who's been a part of residency programs where they are admitting and matriculating candidates into the program. I think that'll be a good follow-up, something for us to talk about in the future. Finishing up here, last couple of questions here. These are the questions. These are 4 questions we ask everybody. 4 questions we ask everyone. So first, number 1, what's your favorite day of the week?
My favorite day of the week is and probably still always has been Friday. Man, Friday is a good day because you're heading into the weekend. You're finishing the week. You're heading into the weekend, and it's just always. When I was in undergrad dental school, I used to always Friday after I finished my exams or my work, before I got ready to study all day Saturday or whatever. Friday after that was my time.
Yeah.
So I got to go to movies. I got to go out, do whatever. And it wasn't all about just, complete turn up, but it was about releasing the stress from the week and just kind of vegging for a while and just kind of relaxing and really just getting prepared, because even when you're in dental school, you're in graduate school, things change. You're not able to take the entire weekend off. You got to study, you got to work. And we would, I say we, my roommate and I, we would take Friday after school or tests or whatever off. So from 5 p.m. until about 8 in the morning on Saturday, that was my time. That's the way I've always still kind of viewed it. And then Saturday at 8 o'clock, though, we were up. We were at the library. We were studying. We were there. We weren't just getting there. We were there with a cup of coffee and, some kind of plan on what we were going to do, studying for the day.
Yep, that's right. Sounds very similar to.
And those things are important,
Yeah, it sounds very similar to what we used to do as well. All right, second question. Your favorite food. What's your favorite food?
Oh, man. My favorite food is probably turkey wings. Good old soul food, man. Some good old turkey.
Grilled
and gravy.
Grilled or fried?
Oh,
grilled or fried?
Oh,
deep fried?
Baked.
Okay.
Baked in the oven. Oh yeah, that's right. With some good old gravy and rice, man. That's heaven.
That's heaven. Third question: what's your favorite procedure that you do in the office? Your favorite procedure?
I think my favorite procedure is probably implants. I really enjoy working with implants, man. Implants is a real good thing. Implants is a real good thing, and I think that it's awesome, and it helps make immediate changes for patients. I mean, immediate in about 3 months, but it really does restore and get patients on a different path.
Right. All right, and the last of our 4 questions that we ask everyone is, what's your favorite activity or action outside of work? What do you like to do outside of work?
Spend time with my kids, man, and see what they're doing. It was I got a later start, I think, than some of my colleagues, and just spending time with them, man, watching them develop and that family time, taking the time to do that. That's probably my favorite thing ever. Yeah.
Good. So tell us any projects you have that you're working on currently, both whether personally or professionally, or things that are associated with the office or with oral surgery. You have any projects that you're working on?
Well, yeah, as a member of the Georgia board, I'm working on, we're changing some of the conscious sedation and general anesthesia rules to try and make things safer for our patients in the state. And, other than that, man, we're working on some things just with my practice, with our business. We're trying to expand a little bit. And so, private practice is an interesting monster. You go through periods of look, let's just settle in, let's just work what we got, and let's make it work. And then there are periods where, hey, look, we got to make some changes. And so, that's what we do. But that's probably the biggest thing is probably my work with the state that we're working on right now. And I've been fortunate to be part of some really great committees and some really, with the American Association of Oral Surgeons and with the state board. And I'm really happy with the work that we're doing because I think it's going to make a positive difference.
Right. And you say you currently serve on the board of the dental board for the state of Georgia?
Yeah. That's correct.
Oh, that's great. That's awesome. That's an accomplishment in itself, for sure. So
some days it feels like that, some days it doesn't.
Well, I thank you so much, Dr. Treadway. How can people get in contact with you if they have questions about more questions for you, or just want to maybe come learn from you, shadowing in one of your offices? Because I know you have a couple of offices. How do people best get in contact with you?
Probably Dr. A. Treadway, DERATREADWAY at AtlantaOralSurgery.com.
Dr. A. Treadway at AtlantaOralSurgery.com.
Yeah. We can also be found online at AtlantaOralSurgery.com. That's our practice.
Okay. And you have how many offices in the Atlanta area?
We have 23.
23. Ooh. Wow. That's another topic too. How to really expand.
Largest oral surgery group in the U.S. At least we think so.
Wow, the largest oral surgery group in the U.S. Wow, Doc, I didn't remember that at all. Oh my goodness. Well, that's great, man. Well, it's been a pleasure learning from you, and thanks so much for sharing your time this morning and going over this information. And I think it's really a value for a lot of folks that are trying to dive into this specialty area, have some notion about what it really takes to become, what your day is like, what to expect. And we just hit, the tip of the iceberg, I'm sure, especially as it relates to once you become an oral surgeon, then what? And, like you shared with us, being on the state board, expanding into 23 and plus offices now, how to run the business side of dentistry. So, hey man, I appreciate you. Like I said, we go way back. We have some very common ties and everything, but really appreciate it, man.
Absolutely.
So,
thank you.
Yes. Anytime. Yes. And anytime you all have questions or you want to find out more about a particular subject area, shoot me an email right here at newdentistcoach@gmail.com, newdentistcoach@gmail.com. I also can be reached on Instagram at @the_new_dentist_coach on Instagram. And shoot me a message and we'll get your story and or your question answered, so we can find out how we can best help you. That's what we do. You ask the questions, and we get the answers for you. Dr. Treadway, thanks so much, brother. And we'll definitely be talking to you soon. Thanks.
Sounds good. Take care.